Hi, this is Dr. Kalaniak, and we're going to discuss the diagnostic physical exam. The purpose of this exam is to examine those body areas that are pertinent to the symptoms that the patient told you about during their history. It is to help you confirm your hypotheses from what you're thinking about as far as the cause of these symptoms. You are focusing on those body areas that are relevant and maybe an adjacent body system. Some clinicians also make sure that they always include what they call the big three, the heart, lungs, and GI tract, because there's a lot of pathology that's found in those areas. But remember, this is not a generalized patient physical assessment. We are focusing on what we need to examine in order to come up with a diagnosis for these symptoms. So let's get started with Marvin. And just to go over a few things, if you don't know what all these new icons mean, you can look them up here. The other thing to think about is that we are giving you a computer clock so that you can look there for anything that requires timing, such as taking a pulse. And also notice that we did, and many times your faculty will give you the vital signs available in the chart. If you do not see that under current visit, that means you do have to take the vital signs. So if you are taking a pulse, you would click on the heart, you would then have your gloved hand, a left click, and you can hear the pulse. 15 seconds is what is expected in all of the physical diagnosis textbooks. You multiply it up, and then you would come up with whatever the number is. And then again, just in all documentation, you're going to document what does this mean. I would recommend unmuting the patient, looking at the time in order to do the respiration. Again, 15 seconds, and then put down what you think it is and qualify it. If you did a mental status evaluation in your history, this is where you would document that. If you need to measure the blood pressure, then you would pump up the manometer, release it, and again, tell us where you heard the start and stop of the Karatov sounds. I'm not going to go through all of this. We've got lots of tutorials that will show you that. What I am going to go over is some of the stumbling points. So a couple of things. Some of your faculty will tell you where the hotspots are for pulse, for auscultation, and sometimes those hotspots will be toggled off and you will just have to know what the landmarks are yourself. The second thing is if we ask you to auscultate the heart or the lungs, it is really important to put in earbuds, earphones, earpods, so that you can bring the sound with high quality close to your tympanic membrane. We do use the Proctor Harvey heart sounds, so that I do want you to start training your ear, because these are real murmurs that are recorded in real patients. You can even hear that minor respiratory variation in the background. Notice we'll want you to do it in the organized fashion, and then these are all the various heart sounds we have. So take advantage of the fact that you're getting high quality murmurs in some of our patients to help train your ear. Same with auscultating the lungs. But again, following your physical diagnosis textbooks, we're going to start with apex, apex, middle, middle, lower, lower, axillary, axillary, rotate. And I really don't care which side you start on. Our computer doesn't care either, but it does want you to do a compare and contrast. And once you've touched a side, it will then become available. So if you don't listen to all the things, you might not be able to pick out what is normal and what is abnormal. But it is requiring that you touch at least the right and left before you can start qualifying what you hear. I'll rotate this around. The other thing that we want you to do is, it's usually most time effective, is if you start at the top and make all your decisions. Do I need to inspect the skin overall? If so, let's do it. Do I need to do a breast exam? What am I doing? And make your decisions as you're going all the way down. Try not to bounce around too much. That will be the most efficient process. So hopefully with these little tips and tricks along the way, you'll do really well in figuring out the physical exam. Thank you so much for your attention.